Today, let's discuss about oral cancer self-screening. This is required in high-risk individuals with long-standing history of tobacco, alcohol consumption and history of HPV exposure. So, we should stand in front of the mirror with a good light and we have to clean our hands thoroughly and remove dentures if there are any. First, we start by examining upper lip and lower lip. With the help of the fingers, we need to retract the lip and examine the lip thoroughly. Then this is followed by examination of the cheek. Use your fingers to retract the cheek and examine it with a good light. Then tongue examination is done. You should protrude the tongue out. You should examine the top surface of the tongue and on either sides of the tongue and beneath the tongue. Then we proceed to the floor of the mouth. The area below the tongue is called floor of the mouth. That has to be examined. And with the help of fingers, you have to retract the cheek and examine both the upper gum and the lower gum on the inner part and the outer part. And lastly, we need to examine the palate. So what are the things we need to look for? You need to look for if there is any white patch, if there is any red patch, if there is any ulcer which is not healing, and if there are any loose tooth without any reason, if there is any bleeding, and if there is any thickening called induration on the tongue or in the cheek. And the last, you need to examine the neck also. With the hands, you need to press and feel the front part of the neck to see if there are any enlarged lymph nodes. If you find any of these symptoms or any suspicious lesions, you need to consult the doctor for further evaluation. Thank you.